Hello and welcome to the Situation Report for Wednesday, May 27th for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith and I'm here with Incident Manager Dr. Stu Kennedy. Dr. Kennedy, things are looking pretty good in our hospital in terms of positive COVID-19 cases. We only have one today. How do you feel about our current state?
Well, I don't want to get overexcited, Tracy, because we've been here before, and then as soon as I mentioned we're in good shape, we all of a sudden we had two present. So at this point in time, we are in excellent shape. One patient was discharged from the hospital today, so we have one positive COVID-19 patient in the hospital, not in ICU, in stable condition. And in fact, looking at the Thunder Bay Public Health website, certainly we have had 81 cases in total, and we only have 2 active cases right now in the community. One's in hospital and one was discharged. So certainly I think we're doing very, very well. We've had no cases since May the 20th, but I'm hesitant to sort of explode with happiness with that, because we still feel there are some cases out there in the community, and as we sort of do more testing, we may find other cases, but we're just getting a trickle, and that's all good news. So from our perspective in northwestern Ontario, we are doing excellent. We have 27 presumptive cases, 26 or 27 presumptive cases, and that number is high because we are still having a prolonged turnaround time from the public health lab, which is 3 to 4 days. We're not doing our quick swabs as many anymore because we have a shortage of them, but we expect that to be corrected probably mid next week. We'll have additional test kits here at Thunder Regional Hospital, and also the public health lab. We're certainly got our fingers crossed will be functional and able to do the rapid testing mid next week, and they have capacity for 300. So things are going in the right direction to both do more timely sort of testing and also getting the results back in a more sort of expedient fashion, and also begin to do more testing on both symptomatic and asymptomatic patients in the city of Thunder Bay.
When do you think that testing, that community-based testing, will increase?
Yeah, so we're just getting a report back from the IMS tomorrow. We've been in discussions with public health, and we still want to concentrate on symptomatic patients. Because our amount of true positives are sort of more accurate at that period of time. But we also realize the need to do asymptomatic testing, to look at the prevalence in the community, and also to look at our essential care workers, like our first responders, our healthcare workers, our long-term care workers, our police, our fire, our taxi drivers, our grocery store, all attendants, all individuals that are exposing themselves to potential COVID-19 in the community. That I would think will sort of begin a program, I would think the end of this week or early next week. But we're still not sort of supporting people just walking up to the assessment center and getting the swab done. We encourage them to call the public health unit, and they will be given an appointment time at the assessment center, and certainly then we'll take care of their needs when they come to our assessment center. As far as walk-ins, I think that has some danger, people just walking up and waiting in line that may not be following the physical distancing. We're not there yet, and I'm not sure if we'll ever get there, but certainly we are going to do more testing here in Thunder Bay. And having said that, Northwestern Ontario, we've done the most testing in the majority of places in Ontario, so we are done well with testing. I think we're close to 9,000 tests that we've had here in Thunder Bay, which is great, and our conversion to positivity rate has been 0.9%. The rest of the province is 4.2%. So that gives us some indication that there's very little in the community right now.
That is really great news, and it sounds like the sort of the landscape of testing in Thunder Bay and Northwestern Ontario will change quite a bit. So just to recap, we're getting more quick turnaround swabs for in-house testing here at our hospital next week.
Yes.
The public health lab here in Thunder Bay is expected to be operational within the next week and a half or so.
Well, next week, I
Even
hope.
sooner.
Yes, yeah.
And those tests are a quick turnaround as well, right?
Yes, they're depending on the volume of tests. We expect them to come back in 4 to 6 hours.
As opposed to those that are being sent to the Toronto lab right now, which take a number of days to be returned.
Too long, 3 to 6 days sometimes. So we're making some progress. So our noise down at Queen Parks has helped. So we're going in the right direction.
Well, you've been waiting a long time for this, and so has the community. So it's really great news. And it's going to be critical as we look at reintroducing those non-essential services, non-essential surgeries, even elective surgeries and procedural activity at our hospital. What's the update there?
Without a doubt, as we begin to increase our services to non-essential services, as of June the 1st, we are going to have sort of a slow increase in our volume of outpatient procedures, surgical procedures, as long as our capacity at the hospital has provided room to take on this volume. And so far we've met all the standards outlined by Ontario Health North. There are 8 criteria, which includes supplies, PPE supplies, physical distancing, certainly an ability to ramp down when we need to ramp down. But certainly we're in, I would think, one of the hospitals, the best in Ontario, to begin to increase the volume of services here, actually. But we have a significant backlog. I mean, as of this morning, we've had over 1,000 CT scans in the queue. We have over 2,000 MRIs in the queue, and these procedures really need to be obtained to make sure we're taking care of the healthcare needs of the community. So we are going to begin to address that backlog in a sort of a graduated type of approach, so we don't overwhelm the system, but also be quite coordinated. And it'll be a different type of business when you come here. What we encourage people to do when they come here is certainly to wear their masks. If they have them, we don't have enough masks to supply everybody, so I'm really appealing to the public when they come to the hospital, Thunder Regional Hospital, to get their own mask so when they come in, so they protect our healthcare workers from the spread of any virus. And also when they come, don't loiter around. Come for your appointment and leave as soon as your appointment is completed. And we may have to change things up, and we're just working on a process there that when you come and check in, if the waiting room is sort of other people in there, we may ask you to go back to your car and come back and check. So the things are going to change a bit, all for the safety of the patients and the staff here in the hospital. So the surgical capacity will increase by about 25%. Certainly our outpatient capacity for diagnostics is also going to increase by 25, and we may increase that more rapidly with priority services to 50%. So we're there to begin this process. We still are waiting for official approval from Ontario Health, but having the directive sort of number 2 sort of decreased or removed as of last evening, we are planning for June 1st to move forward to begin the services of normal operations. And the key thing is, too, that's why the testing and our elective procedures are aligning well, because we have to do more testing for individuals coming into the hospital and undergoing procedures. And as businesses start to open up, we'll have to do more testing too. So things are aligning fairly well with the increase in businesses opening as well as the increase in elective procedures.
So that directive too, that really refers to the Ministry of Health's directive to cease those non-essential and elective services and surgeries.
Yes, that was the sort of a directive that was put in place mid-March by the Ministry of Health, telling all hospitals and also all healthcare providers to sort of begin to decrease your services except for priority urgent services. And that's why we followed that order, but now it's time to sort of begin to ease up on those sort of regulations.
So that's, again, wonderful news for the community. The ministry has given the go-ahead, and now it's just waiting on approval of that assessment that we've completed. What will the ramping up of services mean to healthcare partners in the community and the region?
Well, it may sort of put on sort of an extra burden on our healthcare partners in the region. We have a lot of regional patients come in for their surgeries, their elective procedures, okay, and when they're discharged back from Thunder Regional Hospital, they may need to have inpatient bed capacity in our other types of regional hospitals, our partners. The primary care providers will have to be reviewing the results of their CT scans and MRIs, and they'll have to sort of take appropriate actions based on those results. So we don't expect an overburden to our regional partners right now, but we do think our regional partners have to get back to business too, both from a primary care perspective as well as a hospital perspective, to make sure the needs of the regional patient to be taken care of at the same time the needs of Thunder Bay patients. So we're working good partnership, good communication. So I don't anticipate any sort of influx of increase in significant services at this point in time.
Great. Well, and like you say, it's a slower ramp up. We're starting off with aiming for 25%, and as the situation evolves, we can creep up to over 100% to play catch up.
Right. And one thing I forgot to mention too is people coming into the hospital are still expected to go through the screening table, and if they screen positive, they will be not allowed in to the hospital. And certainly they may want to do their self-screening tool before even coming to the hospital to avoid any type of unnecessary visit, because if they screen positive, they would be not allowed in to have their procedure sort of taken place. So they may want to sort of phone and cancel if they're symptomatic and actually rebook for another time. So it is going to be a different place as the volume of services and the volume of patients increase in the hospital.
Right. Well, thank you very much, Dr. Kennedy. And for those of you who do have an appointment scheduled, please visit our website at tbrhsc.net. You can find that self-screening tool. Hopefully everything is just fine, but if it isn't, you'll know in advance, and you can save a wasted trip and advise the hospital should you need to reschedule. Thank you so much. We'll see you again soon.
Thank you.